Great, so let's get started. Welcome to our series on Pennsylvania's early childhood health and safety system supports. Next slide. Thanks for joining us. Today, our topic is parent, family, and community engagement, teaming up to be healthy and safe. Welcome on behalf of the Office of Child Development and Early Learning in collaboration with the Pennsylvania Key. This is webinar number 2 in a series of 5 webinars being offered. Today's webinar topic, as I said, is parent, family, and community engagement, teaming up to be healthy and safe. It is important to note that the process for sharing these slides and recordings has been updated. OCDEL would like to ensure that all health and safety systems support staff receive these recordings, PowerPoint slide decks, and resources in a consistent manner without creating confusion for the provider community. In order to do so, the PA Key Communications team is creating a listserv of all staff under each department within this system. We will be emailing you these items upon completing each training session, whether you attended a live session or not. Once all of the trainings are completed and the regional task forces are coordinated, we will post all documents on the PA Key Health and Safety Systems page at one time as a reference page. Questions, of course, may be submitted anytime to this email address, hssco@pakeys.org. Next slide, please. Just a few housekeeping points. As you know, we have over 100 people joining today, so to keep things going smoothly, all participants are muted. Please turn off your video. You may type your questions into the chat box, and we will do our best to respond today if time permits. Each live webinar is followed the next day by a 90-minute open space session for additional questions, reflections, and sharing. So questions which are not addressed today will be addressed, if possible, during the open space session tomorrow. Next slide. So my name is Amy Requa. I'm a pediatric nurse practitioner and the senior health manager at the PA Key. And along with me is my facilitator, Laura Johns, who is the managing partner for Propulsion Squared. So welcome, Laura. Next slide. So the goal for today's webinar is to provide support teams with information and resources for assisting providers with tailored communication and family engagement strategies to support the implementation of health and safety plans, policies, and procedures. So here's a list of our support teams that are involved in the COVID-19 health and safety system supports for providers. And just a reminder that while we are focusing on childcare, these principles are relevant to all early childhood education provider types. Next slide. So let's begin with an overview of OCDEL's COVID-19 health and safety plan. Let's review the high points of OCDEL's announcement number C-20-08, which is dated July 10th, which addresses the child care facility COVID-19 health and safety plan. The announcement states verbatim that each child care facility must create a COVID-19 health and safety plan, which will serve as the guidelines for facilities' COVID-19 childcare activities. The COVID-19 health and safety plan should be tailored to the unique needs of each facility and should be created in consultation of guidance and policy issued by OCDEL, the Department of Health, and comply with the CDC guidelines. Each plan should incorporate enough flexibility to adapt to changing conditions. And also, OCDEL's announcement states that this COVID-19 health and safety plan should be shared with all families and staff and posted so that it's visible to everyone. Facilities should post it on their websites and/or social media accounts for greater visibility. So in order to be tailored to the unique needs of each facility, This health and safety planning process will require the programs to engage their families in designing this plan to get their buy-in so that everyone is on the same page and understands the details of the plan. Also, the health and safety plan should address the unique needs of the facilities, families, and children. So this really will require partnering closely with families in developing these plans. Next slide. The elements of the plan include these categories. So let's look at several of the required elements of the health and safety plan that are listed on this slide. As we go down the list, think about how we can support these programs to communicate the plan to families and engage families in their planning process. The first listed is face masks and the facilities plan for the wearing of face masks by parents, staff, and children. It is important to follow OCDEL's interim guidance revision, which was issued on July 8, 2020, which clearly describes all of the requirements for face masks and/or cloth face coverings, as well as the considerations involved. The next listed is the cleaning, sanitizing, and disinfecting, along with ventilation, which addresses the facilities, procedures, and routines for the intensified cleaning and disinfection throughout the day, informed by the CDC guidance, which goes into great detail and emphasizes the safe preparation and use of EPA-registered disinfectants in the child care setting. The next is the social or physical distancing and other safety protocols. These plans and protocols must be tied to each program's management of classroom design, routines, meals, snacks, nap times, and how to safely physically distance people in their facilities and outside their facilities, including safe indoor and outdoor activities, as well as sick child or sick staff policies and procedures, which would fall under the safety protocols. Next is the monitoring of children and staff health, which of course must include the child drop-off and pickup procedures, the routine screening of children and staff prior to entering the facility, and the selection of one of the CDC's methods for screening, which we talked about last week, and which is clearly described in the written CDC guidance published on April 21st, 2020. The monitoring of this includes exclusion policies and procedures for dealing with confirmed positive COVID-19 cases and exposure circumstances. These policies and procedures must be clearly communicated to parents prior to the facility opening up, as well as within ongoing communications through websites and social media and friendly conversations with parents by whatever means possible. Written policies are essential, and including those policies within, for example, a parent handbook will help to keep everyone on the same page with these monitoring procedures. Also, this is going to require protocols for communication with healthcare providers as well, with the Department of Health and with certification representatives, especially when there is a positive case of COVID-19 in the facility, as addressed by OCDEL's interim guidance revision on July 8th. And finally, there will be other considerations tailored to staff needs, individual facilities needs, and the needs of children and families. Next slide. So some of the considerations which need to be addressed during the planning process include these categories. It's recommended for each facility or program to designate a pandemic, or what is referred to in OCDEL's announcements as the Health and Safety COVID-19 Coordinator, or it could be co-coordinators at the facility. This coordinator or co-coordinators will help facilitate the planning process, monitor implementation of the health and safety plan, and think about how to communicate with stakeholders in the community to stay on top of any new guidance that's coming out, which can obviously change very rapidly, and to communicate with the Department of Health and certification representatives about local public health conditions. Obviously, professional development and training of staff will be required to implement the health and safety plan's key strategies, policies, and procedures. And of course, staff may need professional development about how to courageously and empathetically communicate with families during the difficult time of the pandemic that we're in, with deep consideration given to learning and practicing the trauma-informed communication strategies. Also, managing special care plans, individual education plans, and possibly addressing issues around behaviors that may be arising in young children will need to be addressed in a compassionate manner. And setting the stage for a positive response to managing the pandemic in an intentional way, it requires all of these considerations to be addressed. Next slide. So to provide more context, the OCDEL announcement DS-20-08, which was published on July 10th, in which clarifications were issued regarding the health and safety compliance during the COVID-19 pandemic for licensed child care providers and child care certification representatives. The announcement served to further clarify OCDEL's expectations for compliance with the CDC guidelines and compliance with applicable regulations, including the executive orders issued by the governor or secretary of the Department of Health. And in the discussion section of this DS-20-08 announcement, it was clarified that there are 4 critical parts of the CDC guidance for child care programs which align with the executive orders issued by the Pennsylvania Department of Health. And these critical elements are, in summary, the child care staff must wear face coverings. The child care programs must establish and implement a screening procedure to assess for symptoms of COVID-19 prior to entering the facility. And these would include the child drop-off and pickup policies. Also, the child care programs must have a written health and safety plan that aligns with CDC guidance to minimize the risk of COVID-19, and that child care programs must adhere to the reporting of suspected or confirmed cases of enrolled children or staff with COVID-19, and to comply with follow-up guidance for quarantine, remediation, and temporary closure. On this slide is the cover page of the Health and Safety Plan template and the 16-page toolkit, which was linked to the OCDEL announcement on July 10th, which I just referenced. This toolkit includes a health and safety plan template and a planning summary, which covers essential elements required to be addressed in the health and safety plan. Also, it addresses the topics around professional development and communication with families. The toolkit is provided to assist programs in creating and developing and monitoring their key strategies, policies, and procedures for implementing their health and safety plans. And I want to make an important note right here that the template that was provided does not appear to address the CDC's guidance on the 3 possible methods for screening of staff and children during the drop-off of children prior to entering the facility. So we need to be sure that the screening methods are included in the health and safety plan so that all the critical elements required in OCDEL's compliance announcement are being met. Next slide. I just wanted to share another very helpful resource that you might take a look at. This is the COVID-19 reopening playbook from the National Head Start Association, and it includes the COVID-19 conscious discipline free resources for parents, which are excellent, and it provides very helpful ideas about being linguistically and culturally responsive to parents and families when engaging them in the COVID-19 planning process. So now I'm going to turn it over to Laura. Go ahead, Laura.
Thank you, Amy. So I think it's really important that when we think about this health and safety plan, that And I think everybody on this call, you were speaking to the choir. You all recognize that in order for the plan to be successfully implemented, for it to be sustainable over time, for families and staff members to be able to achieve the goals day in and day out of the health and safety plan, for families and children and staff members to understand each component. Certainly children have to understand some of the guidelines that they are implementing as part of the plan. And in order for the plan to be feasible, that many people need to contribute to the plan. So this particular webinar is really going to focus on what are some of those successful family engagement strategies that will really help programs engage their families to buy into the plan, to create a plan that is going to be something that can be successfully achieved over time. So we're really going to focus in on family engagement. And I want to acknowledge Sarah Holland, who is the Special Assistant at OCDEL for Family Engagement, who worked with Amy and I to make sure that our messaging aligned with OCDEL's messaging around family engagement. Sarah would have been on this call and really leading this conversation if she were not on vacation this week. So I want to make sure that everyone on the call recognizes Sarah as an important resource to you around this particular topic. And she has lots of great resources that she can share and will want to be included in the conversations as you have them in your own support teams around this issue. So OCDEL has adopted a family engagement definition that really focuses in on the fact that effective family engagement is about intentionality. It's about the meaningfulness and impactfulness of the engagement that you seek from the families. And family engagement, again, looks differently in a family child care program, where oftentimes the provider has a deep relationship with each and every family member. And it looks different for large centers, where there are many, many families being served, 100+ families. And so we want to recognize that the strategies look different as well. The definition further talks about the fact that learning communities really need to value and support families in their role as the child's first teacher, and a commitment to really leveraging the expertise and knowledge and leadership of families and the community partners to really shape the environment of your program, your classroom, your school, and to shape policy and procedures at state and national levels. And then the final piece of the engagement definition focuses in on the fact that partnerships should be strength-based. They should be culturally responsive and rely on two-way communication. Again, it's not about, I'm going to communicate my policies with my families. It's about having families be able to reflect back and say, this policy might work better if, and here's our input into a policy or procedure. So that two-way engagement is really an important piece of family engagement strategies. And again, this overarching idea about shared goals for the learning and development of the children being served in the early care and education environment. So when we think about the family engagement definition, it kind of allows us to open ourselves up to some questions. And Amy, I would love to lean on you to monitor the chat box for me as we pick everybody's brain on this call to think about how each of you in your role think about how this definition is specifically relevant during this time, and specifically relevant as providers are developing their health and safety plans. So I wonder, again, based on your role in serving providers, how you see yourself when you're providing coaching and technical assistance, how you see yourself helping providers think about family engagement and the definition as they engage in their planning process.
I'm monitoring the chat box, and we need to have some involvement, so everyone think about this. It's
Yeah,
so
yeah, thanks, Amy. Maybe I'll also kind of maybe push people a little bit to think about, how are we going to leverage the expertise of families? How might you guide families in doing that? I know you all do this as very naturally in your work in supporting providers. So I just really wanted to have you share your expertise about leveraging families in the health and safety plan process. It's a quiet group compared to last week.
Yeah, it says here, based on the announcement, they should be mostly finished with their planning process since it was required to be in place last week.
So I'm imagining that providers are reaching out to you all if they are struggling with their plan, or if they have finished it and want some feedback with their plan. So I'm wondering, as you all are giving feedback to the plan that was turned in last week, if some of the feedback is related to how were your families involved in the planning process. And I'm wondering if any of you have stories to share about how programs, family child care providers, center-based providers engaged families in their plans, and if you think people were pretty successful in that.
It says here, seeking to learn about families' concerns about how their children's health and safety needs are being considered could support programs in ensuring that their plans cover and speak to those concerns.
Mm.
That's a valid
So true.
point. Also, asking families what is working at home with their little one or family members about mask wearing and what steps might make sense to use in a program for a specific child or all children. That's a good way to engage families.
Mm-hmm.
Let's see. We have encouraged providers to send family surveys to gauge feedback on needs, but also encourage them to ask for feedback on the plans that they have created. And to ask families to let the provider know what are their biggest concerns about their children coming back to care. Then you can discuss what you would include in the plan. So these are some great strategies.
Absolutely. And I would just really encourage everyone, as you're communicating with your providers, to be asking them, how is the plan going? How are you sharing it with your families? Where have you posted it? Is it on a website? Is it also available in the program? And also to make sure that your programs understand that it's a living document, that as you are trying strategies and you are realigning priorities based on the needs of your families, that these plans need to be looked at often and say, okay, this didn't work. We're gonna try to do it this way. And I think getting families involved with that will be really critical.
And there's a few more comments here that I should share. At this time, we're not able to visit the facilities and are having to rely on Zoom calls, phone calls, or emails. We have to focus more on using the expertise of families and facility staff to tell us about their child or their facility policies and procedures. This is a good time to remember that families and staff have always been the experts, and we are there to support.
Beautifully stated.
Yeah.
Beautifully stated. Again, recognizing the strengths that the providers and the families bring to this process in understanding the children and the settings and the context of the work is really, really important at this point. And your technical expertise to wrap around the expertise of the providers and the families makes for a really strong opportunity for programs to be successful.
I'm sorry if I've repeated this one. We have encouraged providers to send family surveys to gauge feedback on needs, but also encourage them to ask for feedback on the plans they have created. I think programs are interacting with families and addressing individual issues as they move forward. Many folks did videos and Zoom to orient their families and staff. That's good. Participants on the PAS PD have stated that they are using more virtual platforms or SurveyMonkey to gain feedback from the families. My child's provider held Zoom meetings where information was conveyed and questions and concerns were addressed. Also, some providers have experienced the parents who don't want their children to wear masks, and providers are trying to follow OCDEL guidance but lack parent support. That's an issue. There are many more comments and messages here, so I don't know if you want me to continue.
Well,
or...
I think everybody can be reading them as we go too, but I think the overall feeling I get is that you all are in good communication with the programs and helping them remember to touch base with the families and how important that connection is. So it sounds like people are doing a really fantastic job at that.
Yeah.
So maybe I'll shift a little bit over and think about, as we are considering how to engage with our families and where to begin with offering those family supports. How do we know where to start? And I will say that Maslow really offers us a really amazing framework to understand where our starting point should be in providing supports to families. And oftentimes in a crisis, we start throwing supports at people that we think are important supports. Instead of using a very individualized approach and making sure that we are meeting the basic of needs first, and then building our support base to then look at those growth needs that families need. So as you're working and talking with family child care providers and early care and education center providers, and you're helping them think about how to address the needs of their families, you might want to bring them back to Maslow's framework to think about starting at the very bottom of the triangle. Those physiological needs, food, healthcare, shelter, should be the very first things that we are addressing for our families, making sure that our families feel like they have no food insecurities, that they understand where to get food, that programs who need to provide additional food to go home with families can do that or find access to resources to help them do that. So really thinking about the bottom and physiological needs for our families as the first considerations. As we move up the pyramid to the safety needs, we really want to consider questions like, are children safe at home? And given the stressors that families are under right now, this is a question that a lot of early care education professionals and mental health professionals are asking. Are children safer at home or more protected with protective factors in programs at this time when families are struggling with job insecurities, with health insecurities? And so there are a lot of really great resources available that can be used virtually, like the Mood Meter app, which is a fantastic resource to use with our school agers, even children at around age 4 who have access to smart technology or iPads. Teachers and administrators can utilize this Mood Meter app to just check in on children at home, to say, how is it going today? You know, where are you? How are you feeling? To make sure that our children are feeling safe. So if a program is worried about children around absenteeism and things like that, you might want to recommend they put some strategies in place to check on families when they're at home and not in care. Again, moving up the pyramid to love and belonging. I mean, again, this making sure that we have our food, our health care, our shelter, our basic safety needs. Then this next piece that we want to work on is the connectivity between our families in their own family unit, their extended families, their trusted advisors, whether those are faith-based advisors, and then the connectedness between our early care and education professionals, our teachers, and administrators and programs. So again, what supports can be put in place to support the connectedness of our children and families to a larger system of care? And distance check-ins go a long way with connectedness. We've talked a lot about opportunities to connect with families through the health and safety plan. And throughout this next hour, we're going to talk about other ways to really connect with families. As we move up the pyramid, we think about esteem and building up the confidence and fostering the positive emotions of our families and children. And I would say that every mom, dad, grandma, step-parent who is caring for children at home and worried about children not going back to school and how they're going to support tutoring and education, that one thing that early care and education providers and professionals can do is reach out and remind families that they're doing a good job, that they're hanging in there, and really building up the esteem of the families who are actually struggling, and reminding them that, hey, if each and every day you're just spending time with your family and reading books and doing a craft project or taking an outside walk, that doing one activity each day and then building on that is a successful moment. And so it's really important that we remember that one of the ways we can support families is to build up their confidence and to give them the grace and remind them that they're going to make mistakes during this time. And it's okay. It's okay if they missed a homework assignment with their child. They can go back and fix that. This is a hard thing for parents right now. And then the final piece of the pyramid is around greater purpose and achieving goals. And again, as we've taken care of the family's basic needs, then it's time to really think about the growth needs. Now that all of our basic needs are taken care of, how are we able to support others? How can families reach out and be supports to other families? How can we develop these pods of support in our community to support each other as we're trying to figure out how to tutor our children in math? How can we reach out to each other and grow once we've met all of those basic needs? So again, I just think it's really important to always go back to Maslow to recognize and have programs recognize that they really have to start at the very basic of needs and make sure that those needs are being met, and then layer on the supports. And I would be remiss if I didn't say that early care and education providers, specifically center-based providers who have staff members, that these needs also have to be met for the early care and education professionals. Teachers who are working in programs need to make sure that they are also taking care of all of their basic needs in order to support the children and families in their care. And so how can you all as a support team, as coaches, help the helpers, to borrow Mr. Rogers' statement. And again, so Maslow really applies to the operations of the program and the people who work in the program, and then the families and children that we serve. I want to pause there, Amy, just to see if there are any questions or thoughts around utilizing Maslow as a framework to guide how we support families and educators.
Well, there was a comment here that Some providers are in touch with families around meeting basic needs during this time, around food and shelter, for example. It's hard to discuss policy at that point. That's a valid
Mm-hmm.
concern.
Mm-hmm.
Yeah.
Yeah, so thank you. So, I mean, you obviously are really thinking about, like, you're right. You can't go to a family and say, hey, I really need your input on the health and safety plan if that family is wondering where they're going to sleep tonight or how they're going to feed their children. So, again, thank you so much for reminding us of the realities of here we're trying to engage families in helping set policies when they might really be in a situation where they're in the red or orange zone as far as meeting their own basic needs. And again, reminding providers to have grace with those families and really making sure we're putting those families' needs, individual needs first. So thank you for that comment. I think that's really spot on.
Yeah.
So let's talk about challenges and opportunities that the families may be facing, and how providers can be proactive in addressing these challenges, and how we can be proactive in taking advantage of opportunities. So it was great for me to have some conversation via email with Sarah to hear her perspective on some of the challenges that families are facing that she's hearing. And I think one of the points that she really talked about with me was the challenges are 100% contextual and individual. And so we do a huge disservice when we talk in generalities about challenges. And so I want to place that disclaimer that not everyone will have challenges around social distancing. And so we don't want to assume that one family's challenge or one staff member's challenge is something that somebody else is experiencing. So the first challenge for early care and education professionals and providers in meeting the needs of families is that you have to respond individually to each and every family and each and every child and each and every staff member who works for you. So that provides a challenge in and of itself to be individually addressing needs and concerns.
One of the comments, Laura, in the chat box is we're all in the same storm, but not in the same boat.
Mm. Yeah. Yeah. Thank you for that metaphor. It's like so important. And we're also in the same storm, but some of us have like the most amazing golf umbrella, and some of us picked up our umbrella on the side of the road at a shop that wasn't able to, it's not working so well for us. So thank you so much for that metaphor. It's really an important metaphor. Again, some of the challenges that we're hearing the most about are social isolation and families feeling isolated, and early care education professionals feeling isolated. And so again, how do we physically distance, but not socially distance? How do we use technology? How do we use the mail system to touch base with people and send postcards and send care packages and to make sure that people feel connected? Challenges around technology, not only how to use technology, but access to technology. And how are we filling in the gaps around making sure that people have the technology and the understanding of how to use the technology in a way that keeps them connected? I think one huge challenge that you all have experienced so far on each of these calls is the information changes in a moment's notice. And it's hard to be a coach and go out there and say, okay, here's the direction we're going in. And then 2 days later say, hey, here's a new direction that we're going in. and you all want to be confident in the message that you're sending, but we need to be confident in also saying that the messages are changing. And it's important to just remember that we have to be flexible, because as we learn more and gain more knowledge, things are going to change. And each time we change, we hope it's a change for the better. We hope it's a change built on science. and information that we've gathered. So, but that's certainly a challenge to keep up with the changing information. Resource needs also present a unique challenge. Again, the types of resources that families are needing and providers are needing. Some providers are probably still talking about PPE supplies or cleaning supplies, the right type of cleaning supplies, while others are saying the resources that we need is that we're not getting our food delivered on time. And so we are lacking the ability to provide the type of meals that we want to provide because of shipment delays. So again, recognizing different resource needs at the provider level, but also at the family level. And then I would be remiss not to say that there is certainly in a situation like we're dealing with right now, an increased risk for child abuse and neglect for families who are not used to having little ones home extended periods of time, who need that alone time in order to be grounded and able to make decisions that are good for their children. We are noting an increase across the United States in reported child abuse and neglect cases, an increased risk for depression in adult family members, and in youth, school agers, anxiety about what's next. Am I going to school? Am I not going to school? Can I be safe in my early care education program, or am I not safe there? And then a new issue that we're seeing surfacing in the literature around an increase in interpersonal violence, violence between adult family members and family and friends. Again, probably a result of anxiety, depression, stress caused by social distancing, social isolation, and lack of resources, job instability, food instability, all of those issues that really feed into these particular incidences. So I'm curious if you all are seeing these challenges and hearing these challenges from your providers, and if you would add any challenges to this list that you are specifically hearing about.
I'm not seeing any comments.
Okay, I'm going to move on to opportunities, but as people are thinking about challenges, let's go ahead and put those in the chat box. I think each of your shared experiences will help inform other people on the teams.
Laura, there is one comment, if
Please.
you'd like to hear it. That question about safety, I think, is a huge one right now. I have heard a lot that enrollment is low. Families and teaching staff and even the providers are worried.
Yeah, we're hearing nationally that enrollment is about at 50%. At first, we were hearing that about 50% of programs were able to reopen, and then we started hearing about enrollment, and then programs having to cut back and maybe not be so quick to reopen. And that causes a lot of stress at the provider level, for staff keeping their jobs, and obviously the bills that go along with ongoing mortgage payments that have to be paid whether you're open or not. But also, we have to think about when the children are not there, again, are we able to connect with those families who have chosen, in some respect, to keep their children at home, or for financial reasons have to keep their child at home? And are we able to have programs find ways to continue to connect with those families to make sure that things are okay even at home, even sending learning activities to homes to support families, and ideas about books to read, and sending care packages with learning resources. Those are all important strategies to connect with those families who, for whatever reason, have not been able to re-engage with childcare.
Laura, there is another challenge that's been added to the chat box. Providers are saying children are moving from program to program if they have been exposed to someone who had COVID symptoms because they have to work.
Wow.
Yeah.
Yeah. So again, you know, for the challenge for each and every one of you all on this call is, how do you support programs and providing guidance to families about the risks involved in moving children between programs? And how do we help programs do a good job of interviewing families who are then coming to their program saying, hey, I need care tomorrow. Do you have any openings? And are they saying, do you have a previous center that you enrolled in? Is there a reason you're not going back? Having providers touch base with each other. Again, these are really important health and safety questions that need to be explored, because again, those behaviors put more providers and families at risk. So how are we helping providers think about the questions they're asking when enrolling parents or accepting parents for drop-in care, when I know that those providers actually need the revenue? And so it's these are not like black and white questions, and there is no right or wrong answers, but there are answers that protect the health and wellness of early care education professionals who are showing up for work and the children who are showing up for care.
Right. Parents need to work. So what other option is there for them if their provider closes for 14 days? The provider, that's unusual for them to close for 14 days, but maybe in that situation it did happen. But these are the kinds of challenges that are definitely happening right now.
Right. And again, I would imagine a family child care provider who has is a direct contact, who might need to cease care because the provider themselves in a family child care setting, they're the only ones there. So I can see where there might be an isolation period for them that would extend for a long period of time if a family is using a family child care provider. For a center, it's a little bit easier, and I say a little easier because you really need your full staff, your complement of staff, to make sure that you're caring for children in ratio and group size. Again, it's hard because we're posing these questions, and I think we all recognize there is no answer. There is not the definitive answer of how do we support parents in getting back to work when there's a challenge at the early care education setting. And again, the early learning resource centers, I'm sure you all are receiving a lot of calls and are troubleshooting and helping parents think about alternatives and support systems. And I'm sure your phones are really busy with that. And I would really recommend that you share solutions that you're sharing with families across the ELRC network, because I think most of you are troubleshooting and finding answers that will help everybody on the support team.
Mm-hmm. A lot of staff are concerned about their own health.
Mm-hmm.
There are really a lot of comments about that in the chat box. So there's just more need for guidance, I think, and information around the exclusion and, you know, when to close and when not to close, and lots of questions about that. So
Mm-hmm.
we'll have to think about how to maybe come up with some tools that will be helpful.
Mm-hmm. Yeah, some tools and some shorthand guidance. You know, I think we're all used to a lot of words on the page and deciphering it and understanding what it means. And for an early care and education provider, that might become very overwhelming. So how do we shorten our messages and get to points so that people have a bulleted list, a decision tree almost around, if this happens, here's the exclusion pathway. moving to less words and more graphic depictions. So I love your idea, Amy, of what kind of tools can be developed to support that.
Yeah, actually, Pam Schaffner is helping to put one together right now, and I want to share it with certification and make sure that we're all on the same page. So hopefully that'll be coming out fairly soon. Thank you.
Exciting, exciting.
Mhm.
So let's look at some of the opportunities that that have been afforded us. Number one, the biggest opportunity is an increased desire for connection. Again, if we can all think back to the time before, it's hard sometimes for me to remember the time before. But I remember a time when the conversation would have been, how do you get families engaged? How do you get them to talk to their early care and education professionals? How do you get them to share information about what's going on so we can support them? And so now we've really seen a shift in families reaching out and being willing to be more connected, and really relying on and understanding the critical role that their early care and education professional plays in their family. So there has become this huge desire for connection and this huge national respect for the role of an early care and education system. And that is a huge opportunity for all of us. I can remember when people just didn't think about the importance of a family childcare system. And now we know that families have relied on a family childcare system more than any of the center-based systems across the country, that's the one system that stayed up and operating in most states for the longest period of time. And now people are finally saying, wow, family childcare is really an important piece of a functioning early care and education system. Early care and education professionals are critical for the economy of our country and of our state. So these are now things that are the headlines, and provide us an opportunity to say, okay, now how are we going to align federal dollars and supports towards an early care and education system? So that has been a huge opportunity. There's also an opportunity around increased time and availability. So again, more than ever, families are spending more time together in their homes. Maybe not willingly, but they are. And that increased time and availability has afforded families to say, hey, we've instituted family game night, and this is really fun. And we now have a routine for, a Taco Tuesday, and that's really been a fun thing for my kids to look forward to. So I'm really hearing a lot, especially through Facebook, of families who are saying, we now have a new routine and we like it. And so that's exciting. Another opportunity is this empowerment that families have to use tools and resources to really access resources that are available and utilize those, utilize technology, to utilize technology to get their messages out and their concerns out, to leverage decision makers to lobby for their needs around education. There's also been a major opportunity around emphasis on routine over schedule. In early care and education, each one of us have always respected routine over schedule. It's not about the time on the clock. Children don't, that time on the clock is not what keeps children grounded. What keeps children grounded is a routine. This happens first, this happens second. When I walk in, this person is there to greet me, and they understand what my needs are, and they understand how to soothe me. That emphasis of routine has really emerged, and that's good for early care and education. And so that's really an important opportunity to capitalize on. Also, an opportunity has arisen with an increased focus on early education, mental health, the emotional and social development of young people, infants and up, the support that we need to form attachments between parents and children. Again, a lot of conversation now on trauma-informed responsive care, and a lot of professional development being pushed out virtually. on that topic that, again, did not seem on everybody's radar as that important, even though we knew it was always important. Now it's getting national attention. And then another opportunity that I think is really important is this opportunity for parents to be empowered to, by spending a lot of time with young children now, to really be observers of their children's development. I know, as a working mom of 2 young children and a single mom for a lot of those years, that my children spent a lot of time in childcare. And I didn't get to always observe the nuances of things around their development. And sometimes the teachers had to point things out to me. And now we have an opportunity where families are able to really see day to day, hour to hour, the amazing growth and development and learning that their child does each and every minute of the day. And for us to talk about that and to talk about how that really empowers parents as their child's first teacher, I think is an opportunity for our field as we engage with families. Other opportunities that you all are seeing? Well, I'll push on, Amy, and you can interrupt me if you see anything pop into the chat box that you want to share. I do want to focus for a few minutes now on engagement strategies. So some strategies that we can share with our early care and education professionals, our providers, to support family engagement. Again, there are so many ways that we can leverage resources to help families engage with us. And here are just a few of those. And remember, these will really look different depending on the setting. So again, home visitors, as they engage with families, will use different strategies. Family childcare providers will tweak strategies. Center-based providers will tweak strategies. And family engagement in a center, sometimes the lead is not the director. The lead is the teacher in the classroom for the family engagement strategies. So again, I do want to be respectful that this looks different based on the settings. So one engagement strategy we've talked about is that two-way communication. Frequent communication that really addresses learning and the social, emotional, and physical and holistic needs of children and families. And again, really making sure that's a two-way feedback loop between families and early care education professionals. Another engagement strategy is around input related to the health and safety plan, of course, and making sure that we're constantly updating that plan to meet the needs of our families and to meet the changing ways in which we're learning about how to keep ourselves healthy and safe during the pandemic. Conducting frequent check-ins with families. Again, not just the check-ins that happen at drop-off and pickup, which we're hoping is happening outside with some really robust screening so we don't bring any germs into the program that we could keep outside. So it's not just those check-ins, but it's also check-ins at home and check-ins through FaceTime and things like that. So those frequent check-ins with how are things going. Connecting families with community resources, making sure that we have up-to-date resources in our programs that connect families to food or supports for paying rent or mortgage or paying electric bills and utility bills, resources that are out there to connect them to getting books in for their children to support their children's literacy. So again, making sure that programs have access to those resources. And I really think that part of the goals for early care and education coaches and technical assistance providers is that you can provide the resources that the providers can provide to families. Remembering that providers now have more on their plate that they could possibly handle. And if we say to them, hey, have you started gathering resources for your families, is just one more overwhelming task. So how can coaches put together resource packages, get them to programs, Even if you're sending virtual things over in PDF and saying, hey, here's a great resource. Why don't you print this out and put it in your family's cubbies this week? Hey, here is a website. Why don't you text this to all your families? It's a great video from Sesame Street on coping skills. Again, how can we feed resources to providers so that they can feed them to the families? And that would be a huge support that coaches can provide to family units. Another great engagement strategy is around providing peer-to-peer family group supports. So how can you connect families together for family game nights via FaceTime, and have family challenges around I saw something on a scavenger hunt in a family's home where families had 15 minutes to find 2 or 3 items, and they checked back on FaceTime, and the first family was going to get a prize. So how can we connect our family units together virtually to provide their own communities of care, their own communities of support? Again, we've talked about resources to families to support learning, resources to support problem solving, and then virtual parent cafes is also another great engagement strategy. Parent cafes where early care and education experts, health experts, engagement experts, physical activity experts, nutritionists provide virtual parent cafes to share information with families. Sociologists, psychologists who can do some virtual meetings with families to talk about stress. All those things that either can be set up through your resources and then offered to families in family units, but also that programs can offer their families. And to follow up on that, again, some additional engagement strategies. Again, remembering that when we do provide communication and resources, that we're providing them in multiple languages, and we're making sure that they are user-friendly and that they are in plain language. So we don't want to use jargon with families. We want to really give them plain language resources that are individualized to their needs. We want to really think about how to identify and address barriers to learning, not only for our families, but for children in this moment of time. We want to offer delivery services, multiple locations. If we're doing some support services for families around food or school resources, how are we getting those to families? And are we offering multiple locations for pickup, multiple times for pickup? Again, really making sure that we're individualized and intentional about our offerings to families. We've talked a little bit about our involvement for families around the COVID-19 guidance. And then another strategy is to really ensure that our early care and education professionals, our school personnel, are connecting with each and every family. And again, when possible, are visible at full food and school resource distributions. It makes a huge difference when families show up for supports that they are recognizable faces, even though they're under masks, that there are people that they can connect with. So as we're offering support services in the community, how can early care and education providers be involved with those services so that there are friendly faces who know the children and the families being served? Amy, if there's nothing in the chat that we need to address, I'm going to push through looking at our time.
Yeah, I think we're good right now.
Great.
Thanks.
So also just, again, we've been doing a great job at utilizing technology in the field. And so just again, to recognize that technology is a great resource for us now. And texting and texting apps like WhatsApp is a great way to get information into the hands of our families and to engage them, sending quick texts of activities they can do with their infants, tots, preschoolers, and school agers, sending fun recipes that they can try at home. All those things are really supportive. If there's a resource fair going on or a community testing opportunity or something that parents might need to access, sending that via text is really a quick way to get the information into the hands of families. I'm seeing a lot of information about FaceTime and Google Hangouts and video conferencing. I do want to mention, as you all are thinking about, I'm sure you all are saying this in your head, we want to make sure that we're respecting the privacy of families. And if we're in a program using FaceTime to connect with families to show that their children are learning and things like that, we do want to recognize, is it safe for all the children to be in that? Is there permission from families to have their children photographed or have their image on a video? We want to really make sure that the protocols are in place for those children who should not ever be involved in that kind of activity for whatever reason, that we want to be respectful of that. So we do want to ask permission to engage through these kind of video interfacing. And you all mentioned surveys. I think surveys are a great way to get fast information out there.
There's a comment here also, Class Dojo is a great app as well.
Oh yeah, I've heard about this. Google Class Dojo if you've not heard of it, but I've also heard that's really great too. So as we kind of finish our conversation today, Amy and I put together again that you'll have in the resource additional resources for you. Many of these I'm sure you already have saved on your desktops, and you've probably printed all kinds of resource lists for providers and have emailed them, but we wanted to just continue to offer resources that could be distributed to your families. The Emergency Assistance Program, of course, the economic impact payments through the CARE Act, food resources. I really found the PA Nutrition Education Network website to be full of great resources. So I'm hoping people are utilizing that resource and that website. Fantastic early intervention supports being utilized. The Early Intervention Technical Assistance Portal, the Family Support Programs Portal, of course, Compass, which we assume everybody knows about, but let's not assume that anymore, that families who are now having different situations and are trying to figure out, now that they've lost employment or their employment's been cut back, what other opportunities they have to apply for assistance. So we want to make sure that parents are checking on Compass to make sure that they're receiving the assistance that they are eligible to receive. Obviously, the ELRCs and EI and EITA are amazing community resources. Pennsylvania has family support centers in each county that are fantastic resources. I was on a call yesterday with a Pennsylvania PA Family Support Center in a neighborhood, and the amount of work that they were doing to engage families was really remarkable, and how quickly and nimble they were to react, and that they were back up and running, but by appointment only. And so again, those family support centers are a great resource in PA. United Way's PA 211, a great resource for families. The public libraries that are slowly thinking about ways to get books out the door without having a lot of people in the library system, another great resource for our families. And then again, some additional resources. Sarah wanted to make sure that everyone had access to the family engagement framework for PA and the companion document to the engagement framework. All kinds of really great resources and information in there about engaging families and strategies to support family engagement. Additional general resources for children. Brain Pop has some great videos on it and activities. NPR has some really great resources, things that you can print and color, short videos. PBS has a lot of great video games, and they're nice and short and appropriate. anything from hand washing to wearing masks on PBS Kids. These are great resources as families maybe pushing back on masks. They don't have to take the provider's word for it. The CDC has great videos about the importance of masks, Sesame Street, PBS Kids. So again, we should rely on national resources and national messaging about the importance and getting those out to providers so they can be sharing it with their families. Johns Hopkins had some great infographics that are printable that families can, family child care providers and center-based providers can post. And of course, the CDC has tons of information that is available in multiple languages. So hopefully people are accessing those resources. There are also tons of good resources about talking with children about what's going on with the pandemic. So we've listed some resources here. I will tell you that the 0 to 3 resources are really impressive and really focused in on responsive and trauma-informed care practices. So I highly recommend the 0 to 3 resources and videos. Some additional general resources for families coming out of the National Federation of Families for Children's Mental Health. And I also was really appreciative for you all forwarding to me some resources around lactation and infant feeding and ways that we can support breastfeeding moms during the pandemic. So thank you. And we've included some resources around feeding our youngest citizens. And then, of course, the new FAQ resource from OCDEL was just recently released, again, providing additional FAQs around the health and safety plan. It also links to the health and safety plan. So that is hot off the press. And Amy, I think I've gotten through all the resources, so I know if you might want to talk about moving forward.
Yeah, I just wanted to also just repeat what I said earlier, that OCDEL would like to ensure that all health and safety systems support staff receive these recordings, the PowerPoint slide decks, and the resources in a consistent manner without creating confusion for the provider community. So in order to do so, the PAKey communications team is creating a listserv of all the staff under each of these departments, each of these teams within this system. So we will be emailing you the items upon completing each training session. Whether you attended a live session or not, you will get these materials. It's going to take a little bit of time to put those lists together. So please be patient, but we are working on getting all of these resources out as soon as we can. And once all of the trainings are completed and the regional task forces are coordinated or being coordinated, we will post all the documents on the PAKey Health and Safety Systems page at one time, and that will be a reference page for everyone. And also I wanted to just tell you that if you haven't seen any of those previous CDC guidance webinars that I created, there were 5 of them that were pre-recorded webinars with slide decks, considerations and implementation of the CDC guidance for childcare programs that remain open. And it was based on the April 21st guidance provided by the CDC. Now there are some new updates, especially around masks, that are a result of the executive order, right, from the governor and from the Secretary of Health. So you do have to look at those new interim guidances and the revisions and all of the announcements that have been coming out of OCDEL recently. But a lot of the considerations that I addressed in those webinars are still valid and could be helpful. So if you haven't had a chance, at the very least, you could download the slide decks and take a look at them. Also, anytime you need to take a look at the PAK coronavirus website, that would be helpful because there are lots of resources there. And to email your questions and comments, of course, anytime to the special email address there, hssco@pakeys.org. And we welcome your questions, we welcome your comments, and we will do our best to address all questions. OCDEL is committed to reviewing and answering the questions to the best of its ability. And we try very hard to address the questions. And anything that we didn't get to talk about today, we will try to make a slide for that tomorrow and talk about those issues if we can. Again, a lot of the questions that came up in the chat box today were related to when to close the program, what to do if there's not a test that's come back, what if results are delayed, things like that. So there are a lot of questions that are going on right now in communities around those issues. So we'll do our best to address them. And I did want to also tell you that we are working on that decision guide to make sure that we can give that tool to you. And that might be able to help you when talking with providers and give them some good suggestions and accurate information about what to do. So it's a work in progress. Who is on the list? ELRCs received an invite through their program reps. We have never received a direct offer of information, materials, only the invite. That's true. Only the invite to these webinars has been shared thus far. So it's going to be coming soon to get the additional resources, which would include these recordings and the PowerPoint handouts and so forth. So that is coming. So that's it. I think we can wrap it up today and say thank you to everyone for joining. We had 200 and gosh, I think it was 240 people on today. So thanks so much for joining us, and we will see you tomorrow for our open space to have reflection and questions and more interaction around some of these considerations. And that will be from 2 to 3:30. So we hope to see you then. Thanks a lot. Have a great rest of your day and take care of yourselves. Bye-bye.